antiplatelet, anticoagulant, and thrombolytics. Antiplatelets, you have aspirin, clopidogrel, prasugrel, and cilostazol. For anticoagulants, you have heparin, enoxaparin, and warfarin. And you have rivaroxaban, fondaparinol, and dabigatran. Thrombolytic, you have alteplase, streptokinase, tenecteplase, recteplase. And then what kind of drug is clopidogrel? It's an antiplatelet. Some contraindications include bleeding disorders, peptic ulcer, hemorrhagic stroke, or notify the PCP or of drug regimen before surgery and hold the drug prior to surgery 5 days. Indications to the use of anticoagulants used for stroke, AFib, MI, DVT, PE, and mechanical heart valves. It's appropriate to take protamine sulfate as an antidote for heparin if the ATPP gets too long. It should be between 1.5 to 2.5 times the normal control level and 60 to 80 seconds while on heparin. Adverse effects of heparin include monitor for hemorrhage, hematuria, epistaxis, ecchymosis, petechiae, melena, black tarry stools, bleeding gums. If there's an allergic reaction that occurs, platelet levels should be monitored. Medication stopped for platelets that are less or equal to 100,000. Antidote is protamine sulfate. Nursing implications: assess for bleeding. Rotate the sites for sub-Q, and don't rub injection site. Use abdomen for SQ route, and assess the IV sites reactions. Monitor the APTT, and then use caution in patients with recent spinal surgery, epidural or spinal catheters. Use caution with other meds that promote bleeding, like NSAIDs, aspirin, warfarin, and ginkgo. And then some patient teaching for enoxaparin is it's a low molecular weight heparin derivative, sub-Q only, rotate the sites, used to prevent DVT. Do not need to monitor APTT, but need to monitor platelet count due to the risk of thrombocytopenia. Patient may need to be instructed for at-home admin. Some adverse effects include bleeding. You could use protamine sulfate as an antidote. Caution with patient with recent spinal surgery, epidural or spinal catheters. Use caution with other meds that promote bleeding. Some adverse effects include bleeding, hemorrhage, melena of warfarin. Antidote is vitamin K, and it can be given if toxicity or hemorrhage occurs. Patient teaching includes take exactly as prescribed, no alcohol, eat lots of vitamin K foods. Nursing implications: monitor the PT-INR regularly, keep up the follow-up appointment. Some potential drug actions: it interacts with antibiotics and antifungal meds and increases the risk of bleeding. And then it use caution with other meds that promote bleeding and avoid during pregnancy or breastfeeding. Lab monitor values: PT should be 1.5 times the reference, and INR should be between 2 to 3. PT should be greater than 2.5 times, or INR being greater than 4, you will bleed. Interventions to protect patients from bleeding: avoid meds or herbals that promote bleeding. Avoid IM injections and unnecessary venipuncture. Use soft toothbrush and electric razor because this can be less likely to cause cuts. Avoid going barefoot, especially outside. Put patient on fall risk. Instruct patient to avoid straining. Wear medical band bracelets. Eat consistent amount of vitamin K foods if taking warfarin, and monitor labs frequently. Follow-up appointment. The use of thrombolytic drugs dissolving clots in stroke, MI, PE, DVT. Adverse effects include bleeding, internal, intracranial, superficial. Other effects include nausea, vomiting, hypotension, cardiac dysrhythmias. Contraindications include internal bleeding, severe uncontrolled hypertension, recent trauma, and pregnancy. Nursing implications: monitor IV sites or bleeding, redness, pain. Monitor bleeding gums, mucous membranes, nose, injection sites. Observe signs of internal bleeding, decreased BP, restlessness, weak peripheral pulses, confusion, abdominal back pain. Effects of ginkgo biloba is it can promote bleeding.